Hi, everyone. I'm Noah Ivers. I'm a family physician in Toronto.
And my name's Kelly Grindrod. I'm an associate professor in pharmacy and a pharmacist at the University of Waterloo.
So, the big news of the week is this NACI statement. And I know that you've interacted with a lot of patients around this topic. What are you telling people?
Yeah, this is a tough one because I think what we're seeing is the good news is in places like Ontario, the numbers and the case counts are getting a little bit better, which is making us reassess risk and things around vaccines. But we're also learning more. And so what we're seeing is a very dynamic space where we're having to make decisions with different information coming in. The information's always changing. So most of my conversations with people have been kind of them looking back on the decisions they might have made a few weeks ago or a month ago, questioning if it was the right decision, and even thinking about what's the right decision for them today or even 2 weeks from now. So it's a lot of timeline type questions.
Let's break it down then. So let's say, we have somebody come in, they're 28 or more days from their AstraZeneca. What do we say?
So the good news, and I think most people are learning more about this, but the good news about this really rare but very serious reaction that's called vaccine-induced thrombotic thrombocytopenia, VIT, is that it appears to happen about 4 to 28 days after the vaccination, either with the AstraZeneca or the Johnson & Johnson, the two viral vector vaccines. So the good news is if someone's had the vaccine 4 weeks ago, they're in the clear. They likely got their immunity pretty good, pretty robust immunity from the vaccine. And also the risk of it is very little to no risk from what we can see. It doesn't seem to happen after about 4 weeks.
And then they raise the question of, well, what about their second dose? Should they expose themselves to this risk again? And we don't know for sure right now, but what I'm saying to my patients and actually family members about that is where things are heading right now in terms of vaccine supply is that your second dose of a COVID vaccine, if you had AZ before, is probably going to be Pfizer, just based on what's going to be available. And we're expecting data about how effective that's going to be. Most of the vaccinologists and immunologists are really feeling very confident that that's a good way to go. So there's a real reassuring message we can give to people. There's no regrets here. These people are well protected now. They're on their way to being fully protected.
Yeah, I think that's the best take home message here is that, if you got the vaccine 4 weeks ago and you're in the clear, that was a great vaccine, and it doesn't necessarily pen you into needing a second AstraZeneca dose either. So you can take comfort in that.
So then the question arises, well, what if it's been less than 28 days? Then we talk to them about the things to watch out for, of course, that you've seen on the news. These are stroke-like symptoms, unusual and bad headache, swelling of a limb, that sort of thing. And if anything really is awry, the way to rule out whether this process that we worry about is happening is to get a simple blood test, check the platelet count, and move on from there. But of course, then we're left with the final group, people who are not yet vaccinated and have this choice in front of them. This choice of, well, should I get AstraZeneca right now or get in the lineup for an mRNA vaccine? And, you're in the vaccine clinics day by day, Kelly. What are you telling people?
So I think this is a great question. It really depends on your region. It depends on the eligibility criteria for vaccines, what's available to you, what you can access, your risk, but also your own lifestyle. So most of the AstraZeneca supply has been used up in the country. It has been administered to people. I think a lot of people are on wait lists. We're hearing from pharmacies they have anywhere from hundreds of people on wait lists to up to 5,000 people. That's the longest I've heard. A lot of people waiting for vaccines. So they had no problem moving through the AstraZeneca. We got a lot of people vaccinated. That was wonderful. And we're starting to see those numbers come down as a sign of increased vaccination. That's one of the things that's bringing numbers down. It's great. So that means that it's quite possible you might not be able to access AstraZeneca at this point. But if you find one of these lonely doses out there, maybe at a pharmacy that has a handful left, you have to ask yourself some questions. So in your community, is there a lot of variant right now? Is there uncontrolled spread where the numbers are going up? Are there people around you? Do you work? Do you have to go to work in person? And are there people around you that you could get infected from or that you could infect? Another one that comes up, and this has been interesting looking at some of the stories of families who have gotten sick. So the variants tend to infect the whole household. And so what you'll sometimes see is parents who come into the hospital with the kids. The kids might not need hospital care, but there's no one to take care of the children. And so when you're thinking through the risks of the vaccines, we have to acknowledge that some people have a much greater need to be vaccinated as soon as possible with any vaccine you can get. And the great news about AstraZeneca is it's a great vaccine. It's an effective vaccine. It's extremely effective for severe illness, hospitalization, and death, just like the Pfizer and Moderna vaccines. And now with this
It seems
evolving
to
plan.
help stop transmission as well, which is great. So it protects those around you.
Absolutely. So it's the fact that you could get vaccinated and maybe you have the potential of getting it at work, but you don't bring it back to your family, even if you get sick. And so I think with this evolving news around the idea too, that your second dose may end up actually being Pfizer anyway, what this would do is give you access to a vaccine early. Now, that's probably most relevant in regions that don't have a lot of vaccine yet, or where you're still going to be a good 4 to 6 weeks away from getting one of the mRNA vaccines. A lot can happen in 4 to 6 weeks and you might want coverage. So I think that's where we're caught between, say, the statement around the preferred vaccines and the reality and what we hear from a lot of the governments, get the first vaccine you can. That's that middle ground that people are getting pulled between, I think.
I think every day as a family doctor, when I'm meeting with patients, um, it's always about weighing out risks based on a person's own situation, their particulars, just like you laid out. What's their family situation? What's their work situation? And so on. And then making a collaborative decision. So I'd urge anybody who's struggling with this decision right now to reach out to the trusted healthcare professional. Maybe they have a great relationship with their pharmacist, maybe with their family doctor or nurse practitioner, and have a chat about their particulars, try to make a decision that's right for them.